AF Aware is a campaign to explain to the general public and to the medical public the prevalence of an arrhythmia called atrial fibrillation. That's AF. This atrial fibrillation arrhythmia is highly prevalent.
Some figures suggest that over the next 20 to 30 years there will be a doubling of the number of patients afflicted by atrial fibrillation, but we also know that there is a number of unidentified persons in the population who have already atrial fibrillation but who are not aware of that.
Patients with atrial fibrillation sometimes have very rapid and irregular palpitations. These patients are suddenly taken with a fast, irregular heartbeat. It's very frightening, it produces great anxiety, and it's very limiting.
Sadly, atrial fibrillation is very poorly understood by patients, carers, and the general population.
So it's bang, 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 bang. That's a very frightening problem.
That's silly, but you just don't feel well. You think, oh, you don't feel well. And I think it is that you feel you're going to faint.
Well, I had a certain amount of heart pains from when I was quite young.
He was in atrial fibrillation from the first time I ever knew him, really. He was having palpitations, and I don't know whether that's the same thing or not. His heart used to go all over the place, and it was alarming.
The pain, it comes up your body and sort of spreads out till you think you're going to collapse. And I actually did say to my daughter, I cannot take this anymore. I wish I could die. It was so painful.
The quality of life of many patients with atrial fibrillation is significantly reduced. That means their social functioning during their job. That means also that they feel very much restricted in their daily activities by the presence of atrial fibrillation.
It is associated with a large degree of extra morbidity and mortality.
Statistics have shown that if you compare the quality of life of a patient with atrial fibrillation with, for instance, a patient with severe heart failure or with cancer, then it's almost on the same level.
Atrial fibrillation is the #1 cause leading to stroke. It can leave you totally disabled. It can kill you.
He had a stroke in April 2001, and my memory of that is that he'd been in atrial fibrillation for, I think, about 3 weeks, and he'd gone back into sinus rhythm.
We were watching television, and then my sight went, so I can't describe it, and that's all I can remember. And the next thing was, I woke up and I was in hospital. I couldn't speak very well, but I could wiggle my toes, and I couldn't speak properly for 2 or 3 days.
I think that the AF Aware Coalition has a very important role to play in raising awareness of atrial fibrillation.
It's universal, and we really, really must do something about this through AF Aware.
There will be a concerted effort to bring atrial fibrillation to the notice of the general public, to physicians, to professionals working in the health service, the administrators, to governments, and so on.
And make sure that we reach many, many more people. We're talking of millions of people.
The World Heart Federation would like to see a greater awareness of the problem of atrial fibrillation among physicians, internists and cardiologists worldwide, as well as among the patients and their relatives, a better understanding of the underlying disease and its management.
We may have different healthcare systems, we may have different governments, but the one thing in common is every country has patients suffering and living frightened every single day with atrial fibrillation.